Hi guys, welcome to the medical method. Okay, so today we're going to talk about 3 questions. 3. 1. How to answer ethics questions. 2. How to answer friends, honesty, pride questions. Okay, and finally, how to answer the ethics questions that involve you using an amount of money for the public. I guess a public health question, that would be the best way to do it. Okay, so where does I start? Ethics. Okay, yeah, this is definitely a difficult question. They'll ask you something that isn't too contentious, but definitely something that you need to have a developed opinion on. So for example, assisted suicide is a good one. If you don't know what that is, that's like, let's say, unfortunately I'm in the case where I've got cancer and I'm end stage and I'm in severe pain. Now, assisted suicide is where I, as a patient, ask my doctor to basically help me die. So put me to death in a way. And there's a lot of different views on this. Some people think it's murder on the doctor's account. Some people think that a patient should have the right to control their own life. So if you're in this point where you feel out of control, you're just basically asking the doctor to act as a surrogate, as in like act as sort of avatar, if you will, who is acting for your will. Because if you were able to, you would kill yourself anyway. Okay, get where I'm going with that? So it's difficult. There's euthanasia, abortion, all these topics. Basically, it doesn't matter what opinion you have, even that is controversial, but it doesn't. What matters is how you present it. You need to present whatever opinion you have, and this goes for all. This just goes in general in the medical field, but I feel like particularly in the interview, you have to be aware of every opinion when you present it. Now, the person that you're talking to may or may not agree with your opinion. There's no way of gauging that. It's not like when you shake their hand as you walk in, you're like, oh, this person thinks abortion is cool. It's like, you won't know. So the way you present it is, let's say assisted suicide, okay? Let's say I believe in assisted suicide. I'm not saying I do, but let's say for this case I do. Now, what I would say is, look, doctor-assisted suicide is a difficult situation because you have a balance of a doctor's right to preserve life versus a patient's right to control their own life. Whether there's a conflict here, it's difficult to know. My personal opinion is that the doctor's role is to help the patient in whatever endeavors they need. In most cases for a doctor, this is preserving their lives. But in the case where they're in such agony and loss of reality, where they feel that they can no longer go on, I feel that it is a doctor's role to assist in this means. Okay, now that was probably a minute and a half. They will attack you. Depending on who you get, they will absolutely annihilate your opinion. They will try and break it down. They'll say, well, if you think that the doctor likes to preserve life, then how come he's allowed to destroy life? Okay, you think he goes for patient's right? Okay, well, what if a patient feels that he needs heroin? Why doesn't the doctor just give him, prescribe it to him? Things like that. It's hard to describe without being there, but they'll just attack you and attack you and attack you, break you down, try and make you make a mistake. And the key to this is sticking by your opinion. You have to show integrity. At the same time, you can consider what they're saying, but you have to show that you have been mature enough to have formed an opinion and be able to stand by it. This is important, particularly when you're talking about how you're going to treat a patient, particularly in case studies in groups. Imagine if you have the opinion that if you do the surgery on a patient, the patient is going to die. Right? They're basically, in this exercise, they're testing whether if you have 9 people in a group all having a go at you and all trying to get you to persuade to another point of view, they're testing whether you can stand strong in your beliefs, show your integrity, and also show your thought process. Sometimes it takes 1 out of 10 to save someone's life. Same way around, sometimes the 9 out of 10 might be right. So you have to show that you're considering, yes, I understand that, but look, I've thought it through and I still feel that the patient's rights outweigh what the doctor does. And if you're talking about OxyContin or prescribing these kind of drugs, say, well, look, that would be at the doctor's discretion, but still, I feel that the patient has a right to control their life in the end. Okay, so that's a key. Sorry, babbled on for ages. The who do you save question. Okay, so this is in the old interview format. I got asked sort of a version of this question. It's a question that goes along the lines of, we have one kidney to give, here's 4 different patients, like one's a smoker, one's 30, one's 18, one's a politician, all these different reasons. Basically they try and bombard you, and you have to be at the point where you can quantify your opinion. Now, in my opinion, how many times can I say opinion? I believe that this is an analytical exercise, which you should already be good at if you've gotten to the interview stage. Doctors have to have good analytical skills. Now, when you get into this question, there'll be a page on the door. You read the page on the door and it gives information about all the patients. That page will not be inside the room. This is a key. I worked that out because I think it was like my 3rd or 4th question, luckily, and I realized the information that they give you on the door is not the same information inside. Sometimes they give you more information inside, sometimes they give you less information inside. So you just have to be like a sponge. You have to be able to read it in about a minute and just understand it and absorb it. If you need to practice that at home, practice that at home, because they will give you 3 or 4 or maybe even 5 things about each one of the patients. And the key to excelling in this question is having those 5 things in your arsenal, because they will ask you questions that are relevant to those sort of factors on the outside. They have the information, you don't. So once you get in, they'll purposely ask you those questions, make you stressed, and once you start feeling like you're forgetting things, it's all sort of downhill from there. So this one doesn't need sort of a hypothetical. All you need to know is, make your decision on the outside if you can, right? Read them, make your decision, make a clear sort of objective path to why you made that decision. That's the key, objectivity. If you can, at least, if you don't have to remember all 5, but if you can remember 2 or 3, 4 would be excellent. 4 characteristics of a particular patient that gives them the right to an organ over others on a purely objective basis, then that's good enough. If your factors are that they had kids, their age, whether they smoke or not, that doesn't matter. Well, it does, but it doesn't matter as long as you provide a strong enough argument or basis for why you value certain characteristics over others. So in my case, smoking, I'm sorry, if you smoke, and this is another thing, you have to present it well. You say, although smoking, unfortunately, they become addicted and it's unfortunate for the patient, smoking causes destructive systemic damage and it makes the patient more likely to reject the organ, more likely to die in surgery, and just general health reduced, so they will unlikely to live as long and get the most use out of the organ. Bang, smokers are out, basically. Then age. Obviously, we're going to value age. The younger, the better, because the younger the person, the more life, again, the length of the organ. So in my brain, I'm thinking, how many years can this organ get? Okay? Family, all these sorts of things, you can value them depending on how you feel. I mean, I definitely value family over a single person because the family needs someone to support them. But again, then you have to value, well, who's the supporting influence on family? Is it the father? Is it the mother? All these difficult ethical questions. Don't get caught up in it. Make it simple, just snappy, come to a point, and make them understand that you have clear analytical skills and that you know what you're talking about and that you remember. Okay? Memory retention, analytics, and also showing an understanding of the whole problem is key to answering these questions, specifically the ethics questions. Okay, I think that'll do. I'll get back to the grant question on another video. The grant question is really easy. I'll also I'm hoping to do a video on the video style questions, but I'm new to editing, so I'm going to try and find a video that would be good, like a good example video for the questions, and that you can participate in and sort of answer questions as you go. Okay?
See ya.